Vance Culbert. I'm the head of region for the Middle East and North Africa and Colombia here at Geneva, and I recently had the opportunity to visit our programs in Iraq.
Thank you very much for being here today and answering our questions. So first of all, can you talk a little bit about the current conflict situation in Iraq, its recent developments and the main armed actors involved?
Certainly. Unfortunately, we had a terrible bombing in Sadr City just yesterday where 35 civilians were killed. These indiscriminate attacks on civilians with no clear military objective are, of course, one of the worst types of violation of IHL, and this was claimed by Islamic State group. Fortunately, these types of events are less common today than they were a few years ago. That there is nonetheless a range of IHL and human rights issues that we remain concerned about in Iraq today.
Thank you very much. So I note that the protection of internally displaced persons is a huge issue in Iraq. Can you talk about the roots of the phenomenon and its magnitude in the country?
There's still hundreds of thousands of displaced people, both internally displaced people and refugees from successive waves of conflict. This is a very tricky and multifaceted issue. The reasons for their ongoing displacement include things such as lack of services in areas of return, geostrategic considerations, but also sometimes they're blocked from returning by armed groups, and it's the blocking of return by armed groups that's where we have the potential to intervene. So we raised the issue of displaced people with a range of both armed groups as well as religious leaders. It is a sensitive subject. It's a pressing issue is, of course, the displaced Yazidis in Sinjar. But the more sensitive subject is the displaced Sunni groups. Again, the reasons for the displacement are multifaceted, but we had initial conversations with several armed actors as well as the religious leaders in Karbala and Najaf that I mentioned.
Thank you. And today, with the COVID-19 pandemic reaching new heights in the country, what is Geneva's response to help prevent the spread of the virus?
So, during the first peak of the COVID virus or COVID epidemic in Iraq, we signed unilateral declarations on health for the protection of healthcare with a range of armed groups in Iraq. During a meeting with some of these armed groups, one of them mentioned in particular that they had left two health centers that they were using as their military headquarters and converted these back into health centers. They also discussed other measures that concrete measures that are undertaken to facilitate access to healthcare. Today in Iraq, precautions have been lowered. There's not as many precautions. However, these declarations can become important again if we see another wave, which unfortunately looks like is on its way in Iraq. I should say that many of the armed groups also have social assistance wings. They engage in social assistance as part of their how they operate, and therefore linking declarations of protection of access to social services, including healthcare, but also education and others, can fit and bridge their internal the way that they perceive themselves and the way that they engage with their communities.
Right, fascinating. Thank you. Apart from COVID and the protection of internally displaced persons, what are Geneva's other priorities in Iraq at the moment?
So we had the opportunity to visit, as I mentioned, both a broad range of armed groups across the country, including in Baghdad and Karbala and Najaf, as well as in Sinjar and Mosul, in addition to some of the leading Shia religious scholars. And we raised with them some of our primary areas of engagement at the moment. These include displaced people, as you mentioned previously, a sensitive issue, but more easily addressed if we start talking about the displaced cities and displaced women and children, civilians who should have the right to local integration and possibly return if conditions permit for safe return. We also raised the issue of continued occupation of civilian infrastructure. So there have been a couple of good examples of armed groups leaving clinics, but there's still a number of clinics and educational facilities which are occupied by armed groups. So we are going through making a list of what these are and then engaging our groups directly on leaving them.
Well, thank you very much. And can you maybe tell us about Geneva Calls' recent successes in the region? What do you do, and what are the main challenges in Iraq?
There's significant challenges, despite the relative calm that's been experienced over the last period of time. Access remains a challenge both by the large number of armed groups, fractured numbers of armed groups, as well as, of course, COVID lockdowns. This is why I was fortunate to be able to travel to many parts of Iraq during this trip. On the trip between Mosul and Sinjar, there's 14 armed groups, 14 checkpoints, sorry, of which only 3 were being maintained by regular government forces. The rest were all being maintained by different armed groups, primarily Hashd al-Shadi, or Popular Mobilization of Front militias, who do have a statute where they're recognized by the government, but nonetheless often act in a quite independent manner. This has caused access constraints for humanitarian actors in some parts of the country, both in Sinjar as well as in the Anbar area. So one of the things we work on is improving or negotiating access for other humanitarian actors if they're facing constraints, by working with our ongoing dialogue with these armed groups. Other priorities continue to be access to essential services and developing dialogue around displaced people. There is a common UN position that the UN is trying to develop on return both of IDPs as well as refugees, and that involves engagement of armed groups, religious leaders and tribal leaders. So we've also started discussions with the UN to see how we will fit into that broader plan.
Oh, that's great. Thank you. So I have a couple of questions that relate mostly to your trip in Iraq. What was its purpose, and what did you visit? What did you do? What kind of actors did you meet?
Geneva Calls is very fortunate in Iraq to have developed ongoing dialogue with a very broad range of armed actors. The Hashd al-Shadi, the Popular Mobilization Fronts, there's a large number of these who have different political and ideological leanings. Many now fall under the Popular Mobilization Committee, which is based in Baghdad, but not all of them, particularly the ones based in Karbala and Najaf. So it's important to keep up discussion with a broad range of commanders and to talk about the commitments that they've made and possible new commitments, the new memorandums of working that we signed with them to push forward certain IHL, respect for IHL thematics. We are also fortunate in Iraq that the Ayatollah Sistani has issued 20 guidance points, which are strong parallels to IHL, which many of the groups follow, and so we're able to engage in discussion along these as well. In addition to the armed groups, we also have continuing and deepening our discussion with the religious authorities in Najaf and Karbala. We also took the opportunity to travel to Sinjar. In Sinjar, we launched a new project with a local youth group, which is focusing on mine risk education, particularly for children and linked to access for education. The number of landmines and anti-personnel mines in the Sinjar area remains extremely high, and there's lots of more demining work to be done, but also the ongoing groups there need to desist from laying new anti-personnel mines. It's it's very depressing when you drive north of Mount Sinjar and you see the mass graves from the Yazidi people, and you are, and one is confronted with the reality of the mass indiscriminate killing of civilians, and the fact that most of the civilians in the area have not yet returned to the Mount Sinjar area. So raising the reasons for blocking that are continuing to hamper return of civilians to this area is a fundamental objective for us.
Well, this was fascinating. Thank you so much for your time, and see you next time.
Thank you.
Thank you.